Welcome, everyone, to the first episode of the Dental Innovation Lab. I'm your host, Dr. Shervin Molayem. And in this podcast, we're going to be exploring groundbreaking ideas and technologies that are shaping the future of dentistry and how they connect to the broader world of innovation. I'm a dental technologist, advisor, investor in several dental tech startups. And today I bring to you Beverly Hills celebrity dentist, Dr. Daniel Naysan. Welcome.
Thank you for having me. So I've been practicing for almost 20 years now, graduated from USC, and I'm very excited to talk to you about what's going on in the world of dentistry.
You know, it's always good speaking with you. You're always filled with good ideas. So I'm excited to see what you've seen the last 2 decades of practicing. Your practice is in a very great area of Beverly Hills. You're seeing a lot of very high-end, picky patients that really want the best of everything. And you got thrown into that really since your father was a dentist from day one. Most people go work for a DSO. They go open up, in a farther place before they come into a place like Beverly Hills. How was that whole experience?
First of all, I agree with you. I've been very privileged to walk into a practice that has been completely set up in a beautiful location, serving people that really care about their oral health. And part of what has made me great is having all the tools around me to be the best version of myself as a dentist. And we're going to talk about that. And I always say it, I meet people all the time, people that come to my practice. I'm spoiled. I'm spoiled because of the technology that you are talking about, that I've surrounded myself with, that has made my profession easier, made my job as a dentist to serve these patients better and be, like I mentioned, the best version of myself as a dentist.
What pushed you towards that? Was it being in that area? Was it having those types of patients? Was it your curiosity? What was it that pushed for that betterment of your practice and the best technology in it?
It's a combination of a lot of different factors, but ultimately it came down to my love for the profession and wanting to do what was best for these patients that were walking into my office. I always said, I want to treat these patients that are walking in like they are my family. I want that work that I do to last as long as possible and them to leave with the best, highest quality care. And we're going to talk about this today. We're going to talk about all these technologies that I've surrounded myself that have made my profession much more enjoyable. Um, I'm going to take a little segue here and talk about what I've been experiencing recently.
Yeah, go for it.
I've been doing this exercise. I've been going to other practices in the outer skirts of Los Angeles. And it really has shocked me of how people practice. It's a different type of dentistry. I want to use the word archaic.
Okay.
It's not something that I was accustomed to, but you're talking about a lot of older school dentists,
Yeah.
a lot of insurance-driven style of practices,
Right.
a lot of aggressive dentistry, and not using the tools around us to become good dentists.
Yeah.
And there's a lot of them out there, unfortunately. And I think one of the main problems that it comes down to is money.
Absolutely.
And we're going to talk
Yeah.
about this.
Yeah. What are some of those technologies that have, throughout the years that you've been, what are your favorite ones? What are the ones that have helped you the most?
These technologies are one which, if I couldn't practice with them, I wouldn't know how to do dentistry. And it comes down to the basics of me using like an electric handpiece. Okay. Those that don't know, there's air-driven handpieces that sounds like the pitch of like your ears want to just explode. You know what I'm talking about, everybody. You go to the dentist and that sound drives you crazy. Electric handpieces are like electric cars, like Tesla.
Yeah.
And you can control the RPM of your drill and really perform high-quality dentistry with that. I would say that is a basic one that I would say all these practices that I went to visit, not one of them were using it. Why? Because it's an expensive tool.
Yeah.
So we're talking about artificial intelligence. Okay. I see about 100 new patients a month. Okay.
Mm-hmm.
At least 25 of those 100 walk into my office. And what do they say? I went to this dentist. He said I needed all this work and I didn't trust him.
Yeah.
Okay.
Yeah.
So artificial intelligence is great because it's a technology that's going to make us better as dentists, but it's also going to make our diagnosis more reliable. And what's happening now is when I'm using the AI for radiographic detection, now the patient is involved in the experience, the new patient experience, the diagnosis. Say, hey, let's look at this image
Yeah.
together. Versus when my father was a dentist, sir, uh, you have 5 cavities. One of them may need a root canal.
Yeah.
You need a deep cleaning, and you have an infection on the
Yes.
tooth.
Yeah.
What? Like,
Dentists, one thing that we don't have right now as much as we really deserve is the trust of our patients. And if we can gain more of that, and it could be technology that pushes that forward, we need to adopt it. And I have to give it to you. You're one of the first dentists that I know that implemented dental and artificial intelligence in your practice. Uh, which one did you use? Why? What's your experience in your patients when you show them um, what it is and what the caries? Explain the whole flow. How does it work?
Dr. Molayem is
Yeah.
being very modest because he's the one that introduced artificial intelligence to my practice. We work with each other, and we always talk about technology, you and I, and it came up, and the company's name is Pearl. We met the CEO, Ophir Tant, who's a brilliant human being,
Yes.
and thanks to you, I got connected to him. And I became involved in the company before it got patented, before it got FDA approved. And fortunately, I was able to come on board and be really the first practice out there to implement and use it for my patients. It's been a great experience. I think patients that coming in get the assurance of knowing that, yeah, that work that he is recommending is actually necessary.
So how does it work exactly?
Okay, so
What's being done?
there's 2 components to the AI. The one we're using with the patients is called Second Opinion. Basically, what it does is identifies cavities, bone loss, calculus. If you have like a filling or crown that's faulty and shows what's called a notable margin, if you have what's called a periapical infection, which is an infection at the bone level. So it identifies all of this and highlights it in a visual image to the patient. And so it's great because not only is it good for detection, it's seeing things before sometimes a human eye does, but it's a clutch for the dentist. And the second reason why it's so effective is because we can start to do more preventative work for patients. We can start to forecast and say, oh, this is a little problem that's happening right now. Let's not drill and fill it. Let's use our modern day dental medicine and use a peptide and try to remineralize it, which is another technology. When patients hear that, they're like, it starts to like resonate. And you're like, this dentist is not just out there to like work and drill and fill and, this guy is educating me. And I think part of why our practice has become successful is because of all of these tools that I'm talking about.
Yeah.
And AI is one of them.
Yeah. And the patient is getting help more because there's pathology that goes undiagnosed that now is being detected. There's a percentage. You'll say you're 20% into the dentin.
Correct.
Last time you were 15%. You can see the rate at which the disease in the caries is progressing. I think that's a really important thing for people to know that, hey, you may have been stuck at this and it's not progressing. We can just keep an eye on it and we don't have to drill.
Right.
Right. So you could find things that you weren't being able to see before. When you do find it, you can make a better decision based on the percentage of demineralization of that cavity.
Absolutely. I'll take the top 100 dentists in the world, and we can all look at these 100 dentists can look at this image and these radiographs, same x-rays on your teeth. You're not going to get the same interpretation of those radiographs from all those 100 dentists. There's going to be a variance. And what does this AI do? now we're good.
Yeah.
We're all on the same
Yeah.
page.
Now, why do you think it's so hard for dentists to pick up on these new things? Because I'm sure they've seen it. Why does it take so long for them to adapt to it? Um, what are the obstacles here?
I think a lot of dentists, that majority of the ones that are a little bit older, have their own ways, their own set ways, where they practice a certain way, and they fear technology. They're scared of technology because they're scared they won't know how to use it properly. And I mean, fortunately, my father was one of them. It took a while for me to start to bring in these things and use them and have him be part of it. You know, it's they learned something completely different, and they're not used to it. And you're going then in the middle of their career or the tail end of their career and say, "Hey, start to use all of these different stuff."
Yeah.
It's difficult for them.
Yes. Yeah. And I've seen, throughout the years, you were early adapter to bringing in specialists into your office. You have a CT scan, very, high end. Actually, your office looks like a spaceship. It's very, 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 futuristic looking. I think that also helps to give that sense of, cutting edge, right? The feel of your office.
Yeah.
Very, everything's white. The floor, the ceiling, gives a very, pristine feel.
It feels kind of like the Apple store.
Yeah.
You know, when you walk into an Apple store and there's all this technology around you,
Yeah.
that's what I wanted. That was my vision when we built out our practice. And so, like I mentioned, we are doing Four Seasons dentistry. We're practicing as a dentist in the best setting, in a comfortable setting. And I think that's what's giving me longevity in my career and giving me excitement about practicing and going to the office.
Amazing.
And yeah, it's your second home. You spend
Yeah.
more time in your office than you do at home. So why not make that place as the best place as possible?
Yeah, when you're surrounded by something beautiful and then you feel better, right? And if you're there most of your day, then you're gonna have presumably a better life,
And you do better.
and you do better.
You do better.
Your patients feel it.
Yes.
They see it. They feel how you feel it. It all comes together full
Circle.
Yeah, yeah,
Yeah.
amazing.
Yeah. So more technology. Obviously you mentioned CT scan. CT scans are incredible. I would say, Dr. Moran, sure. How many of the offices that you go to are implementing CTs these days? Not many.
It's getting more and more, but yeah, still most don't.
And I think using a CT now should be the standard of care.
Yeah.
How many things are going undiagnosed because you're not seeing a CT? Let's talk about what we're seeing in the CT. We're seeing opening your eyes to why things are happening, which is the airway, which is something that also majority of the dentists are not integrating. They're not connecting the dots. Why does this patient have all of a myriad of dental disease, all of these issues? Why is their gums bad? Why are they getting cavities? We need to think as dentists and say, why? More than just, let's do this.
Yeah.
And so, yeah, we're looking at airway. Airway is connecting the dots for us. And as you know, as a periodontist, these pathogens, these bacteria strive in certain biomes, right?
Yeah.
You know, this is another technology. This is another way of thinking that's making us better as dentists. So you're talking about, 3D scans.
Yeah.
3D scans now.
And a lot of this is we're going out of the mouth, really.
Yeah.
Right. We're now we're looking at a tooth. Maybe then we're looking at a gum, the tongue, right? But there's the sinus, there is the TMJ, there is the airway, there is anatomy. We can see this distance from the molar to molar. Is it wide enough? How deep the palate, the arch of it is.
How it connects to
nasal,
the base of the nose.
right? Are they grinding?
Why are they grinding?
When are they grinding? Right. So now we're finally being able to piece together, right, dental, medical, issues, and then from there we're able to find technologies that are able to intertwine and help push things forward. I'll give you an example. Now, for the first time, we have a company in Velmini that is able to not diagnose, but really detect on 3D, on CT scans, pathology. So now, and other companies are doing that, coming up with that as well. But that's going to make people's life much easier, because right now, one of the things I ask dental office owners, like, why don't you get a CT scan?
They're scared to use it.
Yeah,
They're scared to.
if I take the CT scan and something pops up there and I didn't see it, and then I can get sued. So they're scared. But now we're gonna have this AI that's gonna be able to double check. If there's a problem, it'll alert the dentist and patient.
And that's going to be the new standard of care.
Yeah.
You know, so we're talking about Dentulu, right?
Yeah.
So Dentulu is an incredible company because now, as a dentist, we are going to use all this different technology, okay? And we're going to have a 3D scan, okay? I see a lot of patients, and usually you have to look in their mouth. Would you believe that sometimes with my high magnification loops, that sometimes I'm seeing more on a 3D scan than I do actually look inside their mouth? So you can technically use this as scan, sometimes without even having to open that person's mouth up.
Absolutely.
And see so many, obviously you need to do more than that. But how incredible is that? How incredible is the fact that we can use 3D scans now as a baseline for patients and show them what's happening to their dentition over the course of the last 10 years. How much of your enamel have you worn down? Look at this. Look at what it was 10 years ago. Look at what you did now. People don't realize this stuff. You have this technology to show them. You're going to impress them. You're going to want them to get more involved with good dental care.
Absolutely.
You know what I mean? And once they see things visually, I think it really resonates. It clicks for that patient. And they start to want to be proactive about their health.
Today's episode is brought to you by Dentulu, the future of dental care, right at your fingertips. Dentulu is revolutionizing the way we think about dentistry by offering virtual consultations, 24/7, emergency dental care, and even second opinions, all from the comfort of your home. Their innovative tools like the mouth cam let you monitor your oral health in between visits, and their platform connects you with top dentists nationwide. I've personally checked them out, close with the CEO. It's game-changing. If you've ever been putting off that dental visit, now is the time to try Dentulu. So just head to dentulu.com/DILab and experience the future of dentistry today.
Going back, I could talk forever about this, but you know, part of what you do is bacteria.
Yes.
And so salivary enzyme tests, DNA enzyme tests, you can talk about that a little bit better than I could even. But, you know, what is that doing for you?
Yeah. So I've been doing it on a lot of my gum disease patients. It's like finally there's a name to their problem, right? There's a bacterial name. This is what, there's 11 that we test for, right? There's 4 of them that are high risk, 5 of them that are medium risk, and 2 that are low risk. You can see exactly which ones they have that are high end, and the quantities, right? So when it's above a certain threshold, then it's actually systemically hurting them as well, right? And a lot of these bacteria, they're linked to issues in the body. Like one of them could cross the blood-brain barrier, to survive the acids of the gut, disturb the gut, and on and on. These are cancer-causing or linked to cancer, heart disease. But overall, the relationship is now with cardiovascular disease, they're calling it more of a causal even. That's the new research that's coming out in the past couple of years. It's going a little bit beyond a link now. They're very worried to use the word causal, but they're getting more towards that word.
And when we talk about mouth-body connection, this is it. When you're coming in and you're looking at someone's health history and they're talking about them having high blood pressure.
Yeah.
Okay. Cardiovascular disease.
Yeah. And you went to dental school. You thought you were going to be staying in the mouth and really not having to think about the body as much, right? Other than what medications they're taking, are they safe enough for me to do dentistry on? But it's fulfilling, and it's a new type of paradigm shift for us to know that we are doing things in the mouth that are making their whole body healthier.
Yes.
This was not really known to me when I was in dental school, that concept.
Exactly. And that makes you feel better as a practitioner, don't you?
Yeah.
You're not just going in and being a mechanic for the mouth. You're
Yeah.
adding value. You're adding expertise beyond
Yeah.
just here.
Yeah. And I think the value is first and foremost letting them know about this, right? So about 10, 15 years ago, most people didn't even know this concept of what's going on in your mouth really affects your body, right? Maybe they think, the gums bleed when they floss. They're like, ah. But now it's being put out more and more in I don't know where people are seeing it. Maybe there's an article somewhere. Maybe there's a click on Yahoo somewhere.
It's social media.
Yeah, social
Social
media,
media.
some TikTok reel, showing the bacteria from the mouth going into the brain.
Yeah.
They're starting to get that message. And then simultaneously, the research is coming out that's proving more and more and more this. An example of that is with the P. gingivalis and Alzheimer's and dementia. Uh, Prior, it was the thought that Alzheimer's is more related to the beta the plaque in building up the amyloid protein.
Yeah.
That concept has now been shifted to thinking, no, this is more of an inflammation of the brain. What's causing this inflammation? Well, sugar from our diet, right? Uncontrolled diabetes, sugar, a lifestyle of, having a lot of that sugar, and then the bacteria, right? So the inflammation can actually break down the some of the neurons in the brain, so that's what I mean. People are starting to hear that, and they're like, "Wow,
Yeah.
what? I got to go to the dentist."
And you want to go to a dentist that's doing these things to identify the problem.
Yeah, yeah. Last night I was at a holiday party, and someone told me we're talking about our parents, and they're getting older, and he told me his dad has Alzheimer's, pretty later stage Alzheimer's and this and that, and he's like, I'm worried about myself now, I guess, because he's like, there's a genetic component to it, which is the ApoE4 gene that's linked to it. And so he's like, I'm like, you know what? Have you, checked to see what bacteria are in your mouth? He said, no. And I said, well, go to this, website, and you can get a kit sent to your home, spit, send it back, and they'll tell you if you have that bacteria that's linked to the Alzheimer's.
Yeah.
And if you do have that, then there's ways that you can either reduce that bacteria or get rid of it.
Prevention. There you go.
Yeah. So what you don't know could hurt you, and you have to seek out and find information that can help with your survival. That's what it's all about.
Yeah.
Did you ever get into 3D printing?
3D printing right now can make practices more efficient, deliver care so the patient doesn't have to come back, use better material. We as cosmetic dentists, we've been doing temporaries in the mouth that we make chairside forever. Now, what we can do is print those temporaries. And what's better than that? That material is going to be far superior than what we've been using. And you're going to be doing less work with a higher quality care.
Why is it better material?
So that material, it's going to be polished. It's going to be perfectly pristine. Margins on those restorations. These are for dentists out there. The material is what's called a PMMA. It's the gingiva, the gums like it more than what we're using as bisacrylic. and the aesthetics of it are far superior. We can do a lot. We can glaze it. We can add
Yeah.
some translucency. We can make these temporaries look like very close to the final restoration, those final veneers. What's better than that?
Yeah. And how long does it take to print?
You're going to be probably an extra 30, 45 minutes. And now you're using your technology, you're using your 3D design.
Yeah.
You know, back in my father's days of practicing, he'd have to do that sculpted in the mouth or take wax
Yeah.
and spend hours designing a smile, right?
Yeah.
Now we're doing all that digitally in a matter of seconds,
Yeah.
which is a beautiful thing. And doesn't that make you want to practice dentistry more?
Yeah. No, I've seen you in your office when you pull up their smile on the screen. You're able to design their smile, the gums, and just kind of. It's like you know, when a patient stares at their smile, when you have it big on a screen right in front of them, that's the ultimate like critique where they can see everything,
Absolutely.
and that's where you want to that's where you want to show them and let them show you what you want so that you're on the same page.
Yeah. And now we have the technology to show them what they're going to look like before they even start.
How is that?
So what we do is you can integrate photography, imagery, a facial scanner, right?
Yeah.
With a CT scan, with a 3D scan. Okay. And now you do your digital design, okay, whatever you're using, ExoCAD, DSD, up to what you think would be ideal for that patient's facial features. And that person will have an image, a 3D image of their face with a new smile. Tell me one other elective medical procedure that you can do the same.
That's remarkable.
And and
Amazing.
and you can do it, sorry. You can do it in their mouth without touching anything, touching any of their teeth, and then showing them what they're going to look like. That's what I meant.
Yeah.
What other medical procedure can you show? You can't do that with rhinoplasty. You can't do that with a facelift. These guys can
Yeah.
get an idea of what they're going to
Yeah.
look like without having to commit.
Yeah. That's powerful.
That's technology.
Yeah. 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 Now, talking about technology, also going back to the administrative part of dentistry, the practice management side,
Right.
what have you seen as far as the evolution and some of the wins you've seen with that and some of the shortcomings you've seen with it?
So that was the second component of Pearl that I didn't mention,
Yeah.
which is what's called their practice intelligence. So
Mhm.
practice intelligence, what it does is it integrates with your PMS, your dental software, and it basically highlights to your front office, your administrators in the front that are running the practice, that are calling patients based on need and identifying what those patients need. So it can do it in subcategories like Dr. Molayem's coming in next week. He's a periodontist. We have to find patients that are edentulous in certain areas. So those patients need implants. So now, instead of having to go through and find and look and call, it's right there in front of you. There you go. Their dentists call these patients. Today it brings up your schedule every day and it shows you that you have, let's say, 32 patients, right? 12 of those patients need x-rays. 15 of those patients have small cavities or some version of a cavity. 3 of them may need a root canal.
Wow.
2 of them
Amazing.
have gum disease.
That's-
So
that-
like
yeah,
it already highlights it. Your morning huddles with your staff are gonna
yeah,
just, you're gonna look at that.
Let's double check those.
Yeah.
See if they're there. Maybe we missed it. We didn't let them know, or maybe it's pending on their treatment.
Yeah.
Let's follow up with it.
You're now running a more
Yeah.
efficient practice.
Yeah.
You're running now a practice that's smoother. And once you start to surround yourself with these tools, people in your team become more enthused. They look up to you also and say, wow, he actually is doing a lot to give our patients the best service, you know?
So, other than that, what are the things what do you think as far as the future? What are some challenges that you're having in your practice? or just problems in dentistry that you want to see solved?
One that comes to mind, so I do a lot of cosmetic dentistry. I have patients that actually fly from all over the world to come see us. And I think one of the obstacles that we do now experience is the time the treatment takes. So our process is one where a patient comes in, we do our records, we do a scan, we take photography, and then we start a scan. We start our design. That design, usually we start it the next day. Okay, we bring that patient in, we do our preparation. That patient leaves in with temporaries now with a new design, correct?
Yeah.
Okay. So then I bring them back about a day or two later, have them test drive that smile. And then from the time that they are in temporaries, after they approve that design to the time I put them in, it's usually a couple weeks, right? Sometimes we can expedite it, but I think what's going to happen in the future when you ask me this question is we're going to have the design already made. We're going to have that facial scanner. We're going to integrate it with the CT scan, with the 3D scan. We are going to show that patient what they're going to look like. They are going to consent, right? They're going to say, okay, that's what I want. And then we are going to have restorations made based off of that. And now we're going to use what's called reduction guides. Okay. The dentist is going to put something in a mouth. It's kind of like a stent. Okay. And they're going to do this preparation to make the space they need for that veneer, because a veneer is about 0.5 millimeter thick. Okay. And those veneers will be already made. And they're going to pick the shade. And guess what?
Yeah.
One day. And it's done.
Okay.
No temporaries.
Now let me throw a little wrench in your story right here. Now we're talking about technology, really the evolution of it. From your perspective, you just said something really interesting with the reduction guide.
Correct.
Now, what if a robot is now able to create this reduction guide based off of that prep and now print and create the restoration? Thoughts on that?
I see the light in your eyes.
Are you scared of this?
So I think about these things.
Yeah.
And we've talked about this, and I like to get input back from my patients' feedback.
Yeah.
And I always ask them, I said, how do you feel about this? Because I've already thought about what's happening, and we're going to artificial intelligence.
Yeah.
And you're talking about robotics.
Absolutely.
You have the Yomi already.
Yes. Yeah.
And I think there's going to be initial fear, because the patients that are coming to my practice that I am introducing these concepts to see how they'd feel.
Yeah.
Like, I kind of rather have you do it.
Yeah. Now, can I?
Right?
Yeah.
But if there's somehow robotically we can control the AI, right? Like how there's robotic surgery.
But that's counterintuitive in a way, because the AI
Is more
has some
intelligent
sort of
than us.
autonomy, right? It's being trained to have that autonomy.
But we are watching over the AI is what I'm saying.
So supervised.
Correct.
Supervised, but not
No. Yeah.
not actually controlled. Supervised from
Yes.
Okay. So just to kind of give you some perspective, right? It's good to have perspective. If I were to tell you, 20 years ago, 25 years ago, that there's going to be a car that's going to be driving on the streets with nobody in it, Waymo, and someone's going to hail it, get in the back seat, and there's no one in the front seat at all, what would you say?
Yeah, I wouldn't put my kids in that.
Yeah, right? Just like your patients right now are saying like that. Now, over time, also the Tesla has full self-driving capabilities, and they're heading towards fully autonomous vehicles. Now, every time a car drives by this little intersection, there's the car slow down. Maybe there's a bump there, so now it knows to go slower. Or on the freeway, there's like a pole here. There's a little swerve every time. Eventually it keeps learning, right? Every time I have a full self-driving on my car, and every time I get out of it, it says, what happened? Why did you disengage? and I could push a button and I speak into the car, and sometimes I'll say, there was a car there that you didn't see, you slow down for no reason.
Yeah.
It's getting trained.
Yeah, it's
right?
getting more intelligent every time you give it feedback.
Yeah.
Like
Yeah.
the AI.
Eventually, right? You have to think 2 years, 3 years, 5 years, all this feedback going in, it's going to be able to have, 50,000 people's
Yes.
have chimed in to give the best
Yep.
way forward, so you know where I'm going with
Yeah, I
this.
have this is interesting that you say this because not related to dentistry. We were driving yesterday and one of the at intersection, the lights went out
Mhm.
and there was a Waymo right next to me and the light was flashing red. So you stop, it's like a stop sign, right?
Mhm.
But guess what? Waymo didn't know that it just saw a red light and all the traffic back up. And like, boom, that's another
Yeah,
problem
a glitch.
we have to fix.
Yeah.
But like, there are going to be bumps in the
Yeah.
road.
I saw a video the other day. It was a Amazon truck stopped, a Waymo behind it, and another Waymo trying to get around it, and it was like a Waymo war.
That's hilarious.
Who's gonna do what? And it was just stuck.
Yeah.
Waymo to Waymo. They didn't know what to do. Someone needed to back up. Someone needed to.
Yeah. Now imagine only Waymos existing on the road and not having any drivers.
I actually think that might be better, because at some point you want Waymos to communicate with each other, right?
Right.
So then it'll be much easier.
More efficient.
If you have a car, if you have 40% of cars with Waymo, let's say, and they're talking to each other, but they can't communicate with the cars that are 1960 car. Someone's driving a classic. That's not gonna have the technology to communicate. Um, if you're at an intersection and you could sense where every other car is around you, you can know this car needs to be at least 5 inches away from this car, and that likewise, and they're never gonna touch each other, right?
Less accidents.
Yeah,
Safer.
yeah,
Yeah.
So I think that's where eventually we're gonna have to go. We're gonna have to go towards full everyone, and now this is many years away, but that's good, especially since we have young children. I'm excited about that.
You're right.
Because you want them to be in a safe environment. That's the number one reason why teenagers have issues and accidents. So if one less reason. And how many 16, 17, 18-year-olds that got in a major accident? Most, right? I think that's like the age where people get in their biggest the accidents. So if we could reduce that, as parents, we have more peace of mind, and I'm all for it.
Right.
Now, going back to the company that's working on this right now, is called Perceptive. Now, they have a robot that is able to prep and create a crown permanent,
Or any type of indirect restoration.
or within I think
15
20 minutes or something.
Yeah, 15, 20 minutes.
It's because they've scanned it. They know where the decay is. They know what the reduction has to be. They probably are using some CT scan, iTero, combination of different data inputs, and designing it internally and then performing the function.
I'll go a step further.
Yeah.
I believe that we're not too far away from having AI doing endodontic procedures, root canals. What is it going to... It knows the caries are going to be at the pulp chamber, right?
Mm-hmm.
Right?
Yeah.
So it's going to have a pre-planned stent,
Mm-hmm.
right?
Yeah.
That stent is going to go in. The robot's going to do its access, remove the caries, know exactly how many canals there are from reading the CT scan. What's the working length? It'll be able to get through an obstruction and do the RCT probably in a 10th of the amount of time it takes a human.
Especially with it, it'll develop that tactile feel, right?
Yeah.
I think that's a lot of what endodontics is. It's a blind procedure. You can't see, you can only feel. So once they get that feeling down and it becomes really, really, how do they do it? I would assume
These nickel titanium files
they have some sensors on it.
Yeah.
Pressure, velocity, turning, putting it all capturing it, and just having someone just do root canals all day, capturing all of it, then they could be able to duplicate that and create a robot with that sensor.
These are
It's
amazing
doable.
things. And if
It's
you
doable.
told us, I graduated dental school 2006. You were the same time.
2007, yeah.
Yeah. Imagine they told us, it was not less than a little bit less than 20 years ago. Look at how much has happened. If you told me that version of myself when I came out of school that you're going to have all of this stuff, like, no way, not yet. No, not in 20 years, maybe 100 years.
Yeah, yeah,
I'm serious about this. And now we're talking about robotics. You know, we're talking about stuff that's also going to give us feedback on why things are happening. And the other company that we were talking about recently was Byte.
yeah.
And that's, you want to
Talking about ByteSense?
ByteSense.
Yeah, ByteSense. Yeah. So ByteSense is a really a groundbreaking technology for sleep and bruxism. So it's a occlusal night guard that has sensors that can detect the grinding on a patient, the amount of it throughout the night, and it connects to an app on their phone. So they wake up and they can see throughout the night how much they were grinding, when they were grinding, how hard they were grinding. And there's also ability to see how they're breathing. So there's a oxygen monitor on there, a heart rate, so you can movement.
Are they grinding because they're not getting oxygen?
Yeah. So for the first time in really the history of the world, we're gonna have data on grinding and sleep that we never had.
And majority of patients that you see grind.
Yes.
Right. Majority of patients.
Yeah,
now let me ask you a
some
question.
don't know they do, but
can we implement a technology within that gives us biofeedback to stop?
Yes. And that's what the eventually they're gonna be working on are ways to actually train the person to get out of that habit.
Correct.
Right. Similar to like a wife or partner nudging them during the sleep, they can do some sort of, nudge on a smartwatch, ring, something. Maybe even have the night guard vibrate a little.
Right.
But the technology has only been since really these days that it's been able to happen, right? Because a lot of the algorithms in these sensors now that they're using AI, so it's faster. The batteries, one of the issues with that they haven't been able to do this before is because the batteries are only now able to be so small and powerful. Right? That was the main issue.
Right.
Because remember, the battery has to be like a couple millimeters.
Yeah.
Right? It's nothing. And if that battery could now all of a sudden power for a whole, I don't think you need to charge it for a day or two even.
Right.
So with technology, we're able to improve patients' function, life, get more data, and then be able to reiterate and, improve upon that.
And better health.
Yeah. And
better health. You're talking about,
yeah.
What I failed to say before was airway. And airway is tied to a lot of patients that have sleep apnea, which is going pretty much undiagnosed with a lot of patients in the younger population. Sleep apnea was associated with people that are overweight, have large necks, that are at risk for cardiovascular disease. They have high blood pressure, and they say, oh, you have all the things for sleep apnea. But there's a lot of other population of patients that are young, that are fit, skinny, healthy. Patients like, no way he has sleep apnea.
Yeah, and they snore.
And the patient doesn't even know it themselves. And it had to do not with how fat they were or how large their neck was, how much fat was around their neck or their cheeks. It had to do with the fact of the anatomical relationship of their upper and lower jaw, right?
Yeah.
Now the tongue doesn't have room to move. And when it goes to sleep, what does it do? It depresses and it blocks the airway and not getting good oxygen now. And half the population is tired, but they just think they're just tired.
Yeah.
They didn't get good
I was
sleep.
reading
Or they're like, I went to sleep. I woke up because I had to use the restroom. No, you didn't go wake up because you had to use the restroom. You woke up because you're not getting oxygen.
Yeah. I read somewhere recently that you're not supposed to wake up in the morning tired.
Yeah,
You know,
yeah.
and if you do, that there's some issue, right? And that's an interesting thing. Um, Also, you're not supposed to snore, right? Sometimes we think just conditioned to think snoring is okay, but it's actually a type of choking at night. Um, just the same way that people think like, oh, it's okay for their gums to bleed when they floss a little. That's not normal. So there's certain things that we get used to, and it's in a negative way. We're not supposed to get used to that. That's a problem that needs to get solved because there's large ramifications if you don't
Right.
fix that.
So the big problem is this, but the underlying problem is, first of all, I have a question. What percentage of the dentists, and you go to, you meet a lot of dentists, you go to a lot of practices.
Yeah.
What percentage of those dentists do you think are actually implementing all these things that we've discussed?
Not too many.
So
Yeah.
our job has to be to educate our cohort,
Yeah.
our
Yeah.
community
Yeah.
on how can we be better as dentists?
Yeah, and I think a lot of the dentists they focus on one or two aspects that they like, that's their thing and they really like.
Right.
But to have a comprehensive l- focus on all of those is not very common. And I think it's because number one, there's not a lot of time for dentists to take out of their schedule to learn about all of this, right? To take a risk on a lot of this, right?
Because they're in their comfort zone.
Right. You have to take a risk. Risk monetarily, right? How many times have you bought something, you thought it could be good, and you never used it? So that's a risk.
Yeah.
Right. And you have to, and if you want to better your practice, sometimes you have to take that $3,000 loss on that one thing, or try to sell it,
Or take 3 days off work and go to Arizona to do a seminar, or
Yeah. So, I took actually a sleep class, as a periodontist, which is usually not usual, a couple of years after I graduated. And then lo and behold, I remember vividly now everything that I learned, and it's coming back because sleep is becoming so important in dentistry now.
Right.
So you never also know when you might use it again, or that one patient that does have that issue that you're able to see something, you've been able to help their life.
You change their lives. And that's what these patients say.
Yeah.
I had a patient that was probably in his late 30s, and he was taking a lot of anti-anxiety medication, antidepressants. And he came in, and I went over his health history, went over the medications and why he was taking it. He just thought, he was genetically prone to having all of these issues. And I said, let's see if there's a connection here. And so what we did was we took the CT scan.
Mm-hmm.
Okay? Took the CT scan, and lo and behold, guess what? His airway was obstructed, right? And I could just tell initially looking in the size of his mouth and how narrow his maxilla was, how big his tongue was. And so we did a sleep study, and it was mild to moderate. He wasn't,
So at-home sleep study?
Yes, at-home sleep study. And we decided that we'd start off with a sleep apnea appliance, an oral appliance. So I use what's called the EMA. It's basically moves the lower jaw forward and opens up the airway. You make the movements really slowly, titrate it. So I'm trying to prevent issues with the TMJ. But lo and behold, he came back. I brought him back 4 weeks later, and he looked at me, came back, and he's like, man, you changed my life, bro.
So it advanced their mandible?
He goes,
how much, by 4 millimeters?
No, just very gradually, just.
So is it only at nighttime, or does it change it during the day ever?
No, so you're basically wearing it at night. Okay, right.
Okay.
And it's basically protruding the mandible forward. I try to push them very slowly, because if you do, you will have issues with the bite. And so sometimes these patients, if they're fine with a very limited movement, I don't move them.
What do you do at each appointment? How do you titrate it?
So
turning something?
No, so EMA is elastic band. So it's a band that connects the upper to the lower. And so the first band basically moves it. It's not even like this. You're just like a little open. And what that does essentially is it gives the tongue more room to move, and it relaxes the soft tissue in the back of the mouth. opens up the airway. And these people now that are coming in are like, man, you changed my life.
Are they able to keep their mouth closed during this, or is it
No, it's kind of open.
open?
But you know what?
Is that okay?
It's
If
okay.
their mouth get dry, is that any issue?
They can also breathe from their nose.
Mm-hmm.
So they're not mouth breathing. You can control that. And they're getting good quality sleep. A lot of these patients now are having less TMJ issues
Mm-hmm.
and better quality sleep, more well rested.
Yeah, I'm always afraid of people getting TMJ issues from this.
This is one of the things, but I mean, the other alternatives, let's talk about it.
Yeah.
It's a CPAP machine.
Yeah.
It's orthognathic surgery.
Yeah. No, I really like the mandibular advancement.
Yeah.
But you're just saying there's ways to do it safely.
Yes. Okay. So I use it myself. And ever since I've been using it, I used to have chronic issues with TMJ.
Mm-hmm.
Really, really bad. Headaches, migraines, even my ears felt clogged. And ever since I've been using it for the last 1.5 to 2 years, really my life has changed as well.
That's amazing.
Get good quality sleep. Kept it on the lowest movement band. My wife says you don't snore anymore.
Wow.
Well rested. And when I was talking about that patient, he said, I stopped taking the medication.
Well, what medication?
With the anti-anxiety medication. Why are these people getting panic attacks? Why are they getting anxiety? A lot of it is tied to them not breathing well.
You know, I studied functional medicine, which is a type of medicine that we all know probably, but it gets to the root cause of problems.
Correct.
And in order to get to the root cause of problems, it's like a pie chart, right? And part of life is you have your, diet, you have your exercise, you have your, your community, on and on, right? There's different aspects of your life that's very important, and you really want to control what you can control, right? So, functional medicine, basically, what they say out of all of this entire pie chart, the number one most important thing is sleep. Out of anything in life, it's very powerful. If you want to fix your life, the number one, sleep.
Yes.
Then you go to, diet, exercise,
like
all that. Yeah. But that's so powerful. When I heard that, it really, 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 really resonated with me. And then there's a whole science of sleeping better, taking maybe some supplements, like magnesium, before you go to sleep, or, ashwagandha, or just blocking out your room. So it's, the temperature, sleeping with socks,
positional,
how to sleep, your neck position, what you're wearing. There's a whole thing. So if that's number one, we got to do whatever we can to fix that in our lives.
Correct.
Because we don't want it to have downstream effects.
Correct. So the thing is this, it's a silent killer.
Yeah.
Sleep apnea.
Yeah.
You don't feel it. You don't get the, you don't feel like you're getting good sleep, but you don't realize that it's affecting other parts of the body, the heart, the brain. The brain's not getting oxygen. A lot of these patients are having Alzheimer's or dementia because of it.
This episode is brought to you by dentalgameplan.com. You can really rely on these guys to help you grow your practice. For over 15 years, Dental Game Plan has been helping dental offices across the country and attract more patients, increase revenue, and build thriving practices. Whether you're looking for expert marketing strategies, a stronger online presence, or proven systems to grow your business, they've got you covered. Their team knows the dental industry inside and out, so you can trust them to deliver results. I know many doctors who use them and swear by their work. They are extremely good at what they do. In fact, I want to take a moment to thank our sponsors like Dental Game Plan. Without their support, this show wouldn't be possible. So if you're ready to take your practice to the next level, visit dentalgameplan.com/DILab today, or click on the link below in this description of this video. One other, aspect to this is just being able to do more conservative dentistry.
Correct.
Right?
Yeah.
Could you talk about that?
Yeah. So remember the exercise I did this week? I went to 7 practices in 5 days, and I talked to a lot of dentists in these practices. And what I learned was a lot of these guys are doing a little bit more aggressive dentistry. They're doing full coverage crowns for when patients are having issues with their teeth, with existing fillings that fail, which goes against a lot of the principles of what's good quality conservative dentistry. Okay.
Mm.
Um, we are at a cusp of a dental revolution right now of how we're treating patients. And I would say majority, 95% of, based on what I'm seeing and hearing, are not practicing these essential principles of being conservative as dentists. They're basically, what does this mean to the layperson that doesn't know dentistry? They're shaving around the whole tooth, 360 degrees, to do a restoration, a crown that they think is necessary. Okay. But as we do the research and as we follow the literature of amazing uh, dentists like Pascal Monnier, they're teaching us and they're showing us that less is more, that the less of the tooth structure that we remove, the better the patient will be long term, the less issues with sensitivity.
How about
And
the restoration staying on?
so if bonded restorations, if they're done properly and you're using a technique called immediate dentinal sealing, then you're getting results that are going to have very, very, very high prognosis.
I've heard you say this before. Could you talk about what is that?
So what are we talking about?
Yeah.
If, like I mentioned, these dentists are just shaving around the whole tooth. When they're shaving the whole tooth, what's happening is they're weakening the tooth structure. They're removing the enamel. So what we're practicing right now is more conservative dentistry, where we're only removing what is defective. And we're using what's called a porcelain bonded restoration, whether it's something called a porcelain inlay or an onlay or a 3/4 crown or an endo crown, to bond these restorations instead of being so aggressive with the enamel.
Yeah.
Because once it's gone, it's irreversible.
Yeah.
And when you do shave more, you're actually leading to more issues. You're weakening the tooth.
Yeah.
So I talked to all these, none of them were using these techniques. It's interesting.
Yeah.
Why? A lot of it was ignorance. A lot of it is fear. And some of it is because of insurance-driven styles of practice, because the insurance doesn't cover these procedures.
Mhm.
They are doing something that's worse for the patient.
If they're insured, how does a dentist, the average dentist that takes insurance, what are they supposed to do?
They have to educate the patient,
Okay.
okay? And just let them know that the insurance is just here, but it's not going to cover everything that's going to be necessarily good for you. They are just going to cover certain things. And you have to educate them on why you're recommending something that is not covered and why that is beneficial to their long-term health. And if someone really does care about keeping their tooth as long as possible and as having as little issues as possible, then they are going to pick what's best for them. And that goes down to the number one thing, which is education. Educating these dentists, educating the patients. And it ties back to everything we just talked about, using all of the technology, all of these tools that we discussed
Yes. Yeah.
in making the patients realize what's actually good for them. Don't be happy with this drill. Use this more. Don't use this less.
Yeah.
Use this more.
Yeah.
And I promise you, I'm speaking to dentists out there that are coming out of dental school. You'll feel it's better juju.
Yeah.
You'll feel better about practicing. And when you feel better about practicing, guess what happens? You become more successful.
Yeah. Yeah. I think that's really great advice. And, hopefully the people listening to this will take that to heart. I think it's in this day and age, it's very difficult for the newer dentists,
Yes.
right? Because they come out with such high debt to be able to, be at that level of dentistry. Hopefully there could be something that comes about that will help, help with that. Really,
I'm actually optimistic about the future of dentistry because these students now are learning these principles and I'm talking to a lot of new grads right now, and they actually seem more in touch with this technology than dentists that are our age. Believe it or not, or older, obviously.
Interesting.
Yeah.
Expand on that.
So they're coming. This is something now that's being taught in the dental university, in the dental schools, and I think it's become more mainstream. Versus, I graduated 2006. We had a Prost type education on retention and resistance and all of these dental principles that are basically against this new style of dentistry, the new Monnier conservative biomimetic dentistry, right?
Yeah.
They're still back in 1982.
You know, I heard this one statistic that from literature, from scientific literature to actual practice, where it's mainstream practice, it takes about 17 years.
Yeah.
So should we really be looking at, what we need to be looking at is the science, right? We need to be looking at the research, because you don't want to miss something and we'll have to wait 10, 15 years for all your colleagues to be doing it, and then you adapt.
Correct.
Right? You want to be at the high level science, looking at the review. If one researcher does show something, another researcher showed something, that doesn't mean it's true still, but it's promising. So I think that's also important to look at and keep in mind in this whole thing. In parting words, anything you want to finish off with? Anything you want to say? Anything that's been on your mind lately?
I mean, how can you not be excited about the future? And I think you had something good going on. I think I love bouncing ideas with you about our growth in our professional career, and just talking out to people out there that are dentists. Just want to reiterate that sometimes you have to go outside of your comfort zone, like Dr. Molayem was mentioning, and doing stuff, and sometimes taking a little step back so you can take a few steps forward. And it's a little bit uncomfortable, and there is a learning curve, but I promise you there's light at this end of this tunnel, okay, where we can be happier dentists, where we can practice and feel good about ourselves and use this more, this less.
Amazing. Well said.
Yeah.
Well said. Thanks for joining us today.
Amazing. Thank you for having me.
It was a great talk. Thank you.
Thank you. All right. My man.
Thank you for joining us at the Dental Innovation Lab with our guest today, Dr. Daniel Naysan. Until next time, see you soon.